Hi, here I'm Dr. Zell, and the topic is Osteoid Osteoma. Osteoid Osteoma is a small bone tumor which is a mixed bone tumor having the osteoblastic as well osteoclastic activity. Though it's also called bone forming tumor, osteoid osteoma typically occurs in the cortex diaphysis of long bones, and at least half of all the cases occurring in the femur, especially in proximal and femoral neck. When the spine is involved, the tumor is situated in the neural arch and not in the vertebral body. Osteoidostoma typically occurring in children, particularly adolescents, and it has been studied males are affected 3 times more common than females. Osteoidostoma usually present with night pain and with dramatic relief by the aspirin. Depending on the location of a tumor, there may also be swelling. As in this photo, here you can see swelling of the proximal finger is due to underlying osteoid osteoma. The X mark is exactly over the center of the tumor, whereas in this X-ray, here you can see tumor shows thickened bone around the nidus. Osteoidostoma tumor lesion is well demarcated with lytic lesion and nidus surrounded by sclerosis of the size less than 2 cm in diameter. Depending on the locations, osteoidostoma is classified as subperiosteal, cortical, interstitial, and medullary. The radiological features of osteoidostoma is that the lesion is round, area of radiolucency with sclerotic margins. This radiolucency usually contains a small dense opacity. Its appearance is nidus, and the size is less than 2 cm in diameter. If the lesion is more than 2 cm in diameter, the lesion would be called or classified as osteoblastoma. When the lesion is surrounded by dense sclerosis, further investigations is necessary, requiring over-penetrated films, CT scans, and bone scintigraphy. In case of osteoidostoma, CT is more sensitive than X-rays and MRI for detecting the mineralization, so CT is better for detecting the nidus and presence of exuberant sclerosis. Radiofrequency ablation (RFA) is a safe and quick, minimal invasive and extremely effective method of treatment. And other option is microendoscopic excision of osteoid osteoma. In this radiograph, here you can see an ovoid lucency and the tiny punctate internal calcifications with marks surrounding sclerosis and cortical thickening in the lateral aspect of the proximal femoral diaphysis. In these non-contrast CT scans taken in coronal view, sagittal view and axial view, here you can see cortical thickness that is involving the mid-femoral shaft on the medial aspect with associated sclerosis and narrow zone of transition, and there is a focal round lucent lytic lesion within the center of the sclerotic portion of the femur, suggestive of a nidus of osteoid osteoma. In this CT scan, here you can see a nidus location and typical features of a nidus, which is in the inferior cortex of the lumbar vertebra pedicle, taken in axial view and coronal view.
Please subscribe my channel for more videos and updates.
Audio Jungle.